Hey everyone, Dr. Ritza here, downtown Toronto chiropractor, acupuncture provider, and manual therapist coming to you from the King West Club in downtown Toronto. So what we're going to be talking about today is sciatica. So thankfully I don't see a lot of patients with sciatica. It represents a smaller percentage of low back pain sufferers, around 8 to 10%. But those that I do often come in with rather debilitating pain, and sciatica takes a little bit longer than regular back pain to manage. And the difference between regular back pain and sciatic pain is that sciatic pain tends to be of higher intensity and is more resistant to care. And a big part of sciatica treatment is providing the patient with some exercises or some activity modifications so they are in less pain at home. So with sciatica, that's when you have either a disc herniation, a compression of a nerve root, or some irritation to that sciatic nerve that travels from the back through the buttock and down the leg all the way to the foot. And with this condition, you can have that local low back pain and sharp pain shooting down the foot. And with sciatica, what we often find is that patients usually have a particular intolerance to a certain movement. So these intolerances might be to flexion, bending forward, to extension, bending backwards, to rotation, to side bending, or to direct compression. And providing a position of relief that a patient can use when they have a particular intolerance is amazing for relieving their pain so that they're able to control their own pain levels, and should work over the long term to make the recovery a bit speedier. So we're going to go through a couple of those positions of relief that you can use if you suffer from sciatica to help manage your pain and get your symptoms better faster. Okay, so the key if you have sciatica is whatever bothers you, you generally want to do the opposite of. So if bending forward bothers you, you want to bend backwards. If bending backwards bothers you, you generally want to bend forwards. If something like compression bothers you, like when you take a step or when your heels hit the ground, you want to avoid a lot of compression through the spine. Another way that you can tell if compression bothers you is if you were to grab onto the bottom of a chair and pull yourself down into the bench with your hands pulling up, and you find that that bothers your back and causes pain down the leg, then definitely you are compression intolerant. So you want to avoid a lot of sitting, and you want to avoid a lot of forces that are going to cause compression through the spine. So carrying things or a lot of walking. Okay, so first thing, if you are flexion intolerant, bending forward bothers you, you want to generally maintain more of an extended position. So you can lay more on your stomach, or you can come up through more of a cobra position. And you can sit like this in front of the TV or at home or in the office, and this should provide you some good relief if you have a disc herniation with a flexion intolerance. If your intolerance is to extension and doing that type of position bothers you, you want to maintain more of a flex position. And for that, you want to lay more on your back with your head up, and you can bring your knees in towards your chest, or have a pillow positioned nicely beneath your neck so that you avoid that extended position. Now, most people generally think that disc herniations or sciatica type pain is always worse in flexion, and it's not always the case, so you need to find what's best for you. If you happen to be somebody with maybe lateral stenosis of the spine or a pinched nerve on one side that is worse when bending to the right or bending to the left, you want to do the opposite. So let's say that bending to the left bothers you like this. You want to maintain the opposite. So you can lay on your side in front of the TV and maintain more of a curved C-spine position like this. You can also prop up some pillows beneath you and maintain this position while you lay in bed, and that will take some compression off of the spine and off of those nerve roots and allow more opening as they leave through that spinal canal. If your intolerance is towards lateral bending and you're at the office or you're walking around, and again we have maybe more pain when we lean towards the other side, when we carry our briefcase, say on our right side, and when we compress this way, that really bothers us, then we want to do the opposite. We want to open up the joints on this right side, and what we can do is if we find a wall or a tree or something in the office and we're not able to lay down like we just showed you, you can lean your arm up against the wall and bend into the wall like so, so that you form a nice big convex C curve on the outside and a smaller concave C curve on the inside here to gap those joints on the outside and provide a little bit more room for the nerve to travel out as it leaves the spinal cord and cause less sciatica symptoms down that leg. If you're one of those people that is really intolerant to compression, which we can figure out by either pain when you take a step, when your heels hit into the ground, or when you pull up on the bench like we just showed you, suggesting you have compression intolerance. If you're not able to lay down on your tummy or on your back to take some pressure off the spine, such as being at work, being in a meeting, or if you're out walking around, what you can do is you want to find yourself a table or a park bench, and you want to decompress the spine by putting your hands down with your palms or your fingers towards you, and you want to lean into the bench like so, where my hands and my arms are holding all of the weight of my body and my feet are barely touching the ground and barely providing any support, and this will really help to take some compression off of the spine and will temporarily help to relieve your symptoms, whether you're out taking a walk or in a position where you're not able to lay down. Most sciatica sufferers are going to have a really large intolerance to rotation, and one of the biggest feats in their day is getting out of bed. So how I want my patients to manage getting out of bed is as follows. So generally, if you're sleeping on your back or in the side, and what we want to do is, as we lay on our back and we need to roll over onto our side and get out of bed, is we want to make sure our core is nice and tight, as we've talked about in some of our other core videos. And what you're going to do is you're going to bring your knee up, you're going to bring your arm up, and you're going to slowly, keeping your core tight, try and rotate over onto your side, nice and easy. From this position, what we're going to do is we're going to bring our knees up, we're going to bring our arm right through here so we have a nice way to propel ourselves. Our core is nice and tight, and we're going to work on, in one piece, swinging the legs down and swinging our upper body up so that we don't have to rotate with the core nice and tight. Just like that. So when you do that, that's going to minimize the amount of rotation that you have to put as you get out of bed. So again, roll over onto your side, keep the core nice and tight, bring the knees up, push up off the bench, and that's going to help you get out of bed a little bit easier. If you do suffer from that flexion intolerance that we already talked about, where you want to maintain more of that extended cobra-like position when we lay down, a big thing that's going to bother you is bending over to pick something up or putting on your shoes and tying your shoelaces. So what I want my patients to do when they have that flexion intolerance or that initial disc herniation symptoms, to tie your shoes, really simple trick. You want to pull your leg up onto your knee and tie your shoes from this position. In terms of bending forward, picking stuff off the ground, what we want to avoid is losing that neutral spine in the back and flexing too far forward. So if we're going to pick anything up off the ground, we're going to do it one of two ways. We're either going to do it with a golfer's stance, or we're going to do it with that nice neutral spine. So if I were to drop something on the ground, we're going to work on bending down like this through the knees, picking it up nice and close to the body, and coming back up with it. Our other option is we can extend backwards like a golfer would to pick up the ball, bend the knee down, and come up like so. Those little tricks combined with tying the shoes are going to really help a lot of those people with sciatica symptoms that are intolerant to flexion.